Charlie, Megan, Luke and Robbie from Sword, who've joined us today to tell us more about their offer and how you will be able to use it and get in a live demo. So I'm just going to cover off the agenda for today. So we've got just a quick short 5 minutes introduction. Thrive will take over and share a little bit about the platform, then the service, and walk through how it's set up. Also have a platform demonstration and how the patient would see that as well, which I think is really important for our WorkWell coaches. Also look at outcome and impacts and next steps in QA. Please note we've got questions and answers as well as the chat function for those who would like to ask any questions throughout, but you can also raise your hand and we'll do our best to answer all of those questions throughout the session. So just to tell you a little bit about ourselves, for those who are not aware of the Health Innovation Network, we are one of 15 across the country. We are probably one of the biggest. And the things that we do is we tackle national problems, but looking at that local perspective across North East and North Cumbria. And we each have our own kind of areas that we focus on. So we do some national programmes as well as some local programmes, depending on how we are commissioned. And we are supporting the WorkWell programme around some of those digital solutions. And an element of work that we do is also about driving economic prosperity and growth across our region. That's not just from innovations in the north and in the NHS, but also from those innovators who might have a small business who want to implement solutions or get an idea off the ground. I'm just flashing on the screen here our innovation pathway. So this is how an idea starts and all the stages it might go through before we actually implement. And for the particular products that we're talking about today, we're looking at that regional adoption and looking at how we continue to spread that. So you'll all know about the WorkWell programme because you've been involved in that. So the NCICB are receiving about 18 million to improve the population health. And we are a little chunk of money is coming to ourselves, 1.46 million, to support the rollout of digital innovations, of which there are 6, 2 are region wide, 2 are slightly smaller projects and 2 are local. So the information has actually just been launched today, so you will get sight of all of those products across our region. So that's my last slide. Which is how we picked everybody. So we did go out and get about 130 applications, and as a result of the work that went in the background and a Dragon's Den approach, we chose 6 solutions with our ICB, which we want to implement as we see brilliant benefits moving forward. I'm going to hand you over to Sword, but before I do that, just to give it a little bit of background as to the reasons that we've chosen them. So it's got an MSK programme with combined AI, so it allows remote physiotherapy support. It's looking at use as pain, condition and progress. It's an at-home kit, so they get posted out, which is absolutely brilliant. And it's monitored by that human element of an expert physio who also offers one-to-one support. They've got a brilliant evidence base, which I'm sure they'll touch on today, and it's really one of those things that we are rolling out region-wide as a product. So whilst there's a focus on rural, there will also be licences for each of the remaining 3 LTT areas. So that's it from me. I'm going to hand over to our Thrive team.
Thanks everyone. Thank you for joining us today. I'm now going to share a couple of slides as well, and then I will hand over to Megan, who is our clinical specialist director, to do the actual demo of Thrive. So I'm now going to share my screen. I do need to tell you that I lose you all. I can't see anything. So if anyone raises a hand, please just someone let me know. And there are questions at the end. So I'm hoping everyone can see that. So this is meeting with us at Sword today. This is just our little agenda as we go through, and I will introduce us all. So I am Charlie Ross. I am the customer success.
Apologies, just needs to go full screen.
Oh.
On the slide deck. Yeah, so if you click slideshow. Yeah, perfect.
Sorry.
It works.
I'll start again. I am Charlie Rossi. I am the Customer Success Manager for the UK. You are joined by Luke, who just spoke. He is our UK Director of Operations. Robbie is with us as well. He's our UK Medical Director. And Megan, who will be doing our demo, is our Clinical Specialist Director. We also have Matt Beattie, who's our UK General Manager, and Natalia Cuso, who is our Marketing Associate. So Sword was started back in 2015 by our founder called V. His brother had a really bad car accident. They are based in Portugal. They had a 6-hour round trip to be able to attend the physio appointments, and V decided that there had to be a better way to be able to access the physio that his brother needed. As they move through, they have done 41 clinical research papers, so all of the outcomes are really well established, and we have 43 patents to our technology as well. This is how Thrive in the beginning of the program, our solutions started. So we're here to talk about Thrive today, which is our MSK solution. And at this point, I am going to hand over to Megan for the demo.
Hi, thank you so much. I am going to just talk through the member experience a bit. Charlie, do you mind just sharing the next screen that shows the member journey? Perfect. Thank you so much. So when a member is or patient is appropriate for a Sword, somebody who has MSK condition that we'll discuss a bit, we'll get the referral and then we'll send that patient an onboarding form to complete so that they can tell us a bit more about how their condition's impacting their life. And those are the types of questions we ask at the onboarding that we'll ask throughout the program to make sure we're making progress with everything we want to work on together. After they complete the onboarding form, they'll schedule a call with their Thrive physiotherapist. And during this call, we'll screen the person to really understand what their concerns are, come up with a plan to address their goals, and make sure that they're appropriate for the digital physio program. After the call, we'll send them our Sword device. So I'll be screen sharing from my device. Our medical device is a locked tablet. The only thing it does is their Thrive program. So the patient turns it on. It opens up the exercises that were personalized for them by their physiotherapist, guides them through the movements using computer vision technology to track and provide real-time feedback, and then takes the information from each session back to the physio so the physio can see where the person was successful or struggling and what adaptations need to be made so that they can continue to progress throughout the program. During the program, the patient and the physio also will connect via chat-based messaging in our app, as well as video calls as needed. And we have educational content available to help them learn more about managing their health. So for example, if somebody's having pain with sleeping on their shoulder, it's waking them up quite a bit, we'll work on an exercise program to address that shoulder pain. But we also have great video content that shows them how to adjust their sleep space. So when I discuss with them on the video call some sleep positioning techniques that might help them sleep better, the video in the app will help reinforce that while they're actually going to bed that evening. So that throughout the program, we'll work together to make sure that the sessions are challenging but appropriate, that they're progressing as we'd expect, and that they're getting the education they need to manage their condition and their health. This typically takes several weeks. We'll be working together for somewhere between 4 to 12 weeks, depending on the person's needs, until they've achieved their goals. We've mentioned if there's questions, please feel free to throw them into the chat or raise your hand and ask them, but I'm going to share what that member experience is like with the technology now. So I'm going to walk through how the person actually uses the device once they've enrolled in the program and met with their physio to get real-time feedback. When you turn on the device, it will connect via Wi-Fi and push any updates to your program for you. So every time you do a session, it's really customized to where you are in your
I'm not detecting any internet connection.
Apologize, my Wi-Fi is being a little funny today, so I'm just going to go and turn it on. So at the end of the program, or at the beginning of the session, it will give the member the exercise overview of what they can expect for that day. So for example, if I'm working on knee pain, I might be working on just bending and straightening my knee, balancing and building some hip strength at the beginning of the program. And then as the program goes on,
welcome to your session.
I'm just going to mute her here. As the program goes on, I'll be able to learn more about the entire condition by working on more complex movements. So we'll go ahead and start my next session. It's muted so you can hear me. As I go through the movements, I will turn it off mute so you can hear some of the device's feedback, but it's going to provide me guidance, both written and audio throughout. My device is set up on a tablet. I'm just going to stop and make sure I'm in frame. So here you can see that the camera is on my body to track my movements. The skeleton is all that we're recording. So we're not recording any video or audio. We're only recording like the skeleton-based movements. So I could be in my pajamas. My background could be, you know, a normal house. My physio wouldn't know that. They would just know how I'm performing the movements. For the next exercise, I'm working just on a standing hip abduction. So what we're going to measure for the member is how far they're moving, and we'll show it to them in a really gamified way. So on the right side of the screen, you can see there's a little progress bar with stars. As I move my leg, I earn stars, and those stars ding. What my physio is going to see is a range of motion measurement like they would take if I was in clinic and they were tracking that. So here they'll see as I do more repetitions, my mobility increases a bit. I'm able to get more range of motion and perform the exercise correctly and safely. I'm going to turn on the audio so you can hear how she guides me.
As you face the camera for the leg to the side exercise, try to exhale gently as you lift your leg out to the side and inhale on the way back. Get ready. Place your feet shoulder width apart by following the circles on screen.
So here it's showing me that my starting position for the squat is not accurate.
Down.
So it has me move my feet apart, and then let me go ahead and perform the squat. If I do it correctly, that body overlay turns green. I can see the progress bar fill up.
Looks like you're leaning forward. Try to stay upright.
If I make a mistake, she'll
Down.
provide me coaching so that I can correct. The
Down.
physio will also see the mistakes I made. So there, for example, I got the coaching to stand up straight, and I was
Down.
able to correct for the next repetition. So they probably don't need to change the exercise. But if I was having trouble making mistakes multiple times, they might choose to change that exercise for me in the next session. Sorry, was there a question or is somebody just off mute?
Just a reminder to pop yourselves on mute so there's no background disturbance. Thank you.
Perfect. So at the end of the session, we're going to collect some information that the patient can share back with their physio. So for example, if I'm having some pain, I can mark that here. If I'm having fatigue, I can share that here. This way my physio will know that I had a bit of trouble, but it was nothing too bad, and something they can track and adjust for. At the end of the session, I can also share feedback about my overall experience. Perhaps I want to let them know that the squats were a little bit too challenging today, but maybe the hip abduction exercise was easy. All that information is just used to further customize the program for the member. So I'll go ahead and stop sharing that screen. Once I'm done with my session, I turn it off. That information goes back to my physio, and the physio will then be able to make adjustments to the program. And the reason they can make adjustments to the program is because they have information about that exercise session. So I've done my session, I'm going to work, no big deal. In the background, my physio is looking at the results to see where I was doing well and where I might need additional support or cues. So here, this is a person's shoulder exercise results. On this session, I can see an overview of how it went. So as the physio, I can see that there were some exercises that went really well. They performed them perfectly. Other ones where they made some mistakes. If I want to learn more about what types of mistakes that person was making so I can better adjust the program for them, I can actually see every repetition. So I'm not seeing a video of what they did. Again, we're not recording any video or audio, but I see when they made a mistake, what was that mistake? So in this exercise, the person's just bringing their arm in front of their body overhead, just a forward shoulder flexion exercise. First repetition, they drifted out into abduction a bit, got the cue from the device. She told them to keep their arm in front of their body. The next one, they bent their elbow to compensate. Then they were able to perform that exercise correctly on the third repetition and achieve 134 degrees range of motion. That's great. The next one, they drifted out again. They were able to correct, drifting out again, correcting. So in this case, I can see that they have a tendency to try to avoid going through that straight flexion range of motion. Likely it's causing a bit of discomfort, and so they're trying to move in a way that they can avoid that discomfort. I don't really want them to practice this movement in this way because it's not going to give them a lot of benefit. They're just going to practice compensating. They might get their shoulder a little angry. It's not going to get really helpful for them. So instead, based on the results here, even if I didn't hear from this member, if they weren't a big talker, I would be able to tell that their next session probably should have this exercise in a different way. So perhaps instead of standing up, I can have them lay on their back and perform it in supine, work on controlling the range of motion without having to fight against gravity to lift up their arm, and see if that allows them to perform it more effectively. After I make the changes to their program, like jump in and actually change the prescription, then that will just push to their device again. The next time they go into their program, it'll be there, and I can send them messages in our app so that they understand why I'm making those changes. So this relationship between the physio and the patient is really intimate in terms of being able to adjust the sessions for where that person is, make sure that they're effective, helpful, and meeting them where they are, and then allowing some support throughout. So if somebody's really doing well, they're engaging, and we're progressing well, the support might be really positive. If somebody's struggling to do their sessions, I see that as well. And I might say, have to focus on problem solving when they can actually perform exercise in their day-to-day so that they're successful with sticking with their program. Gives us a lot of information to really customize that journey for the person. I'm going to pause. I think I see one question in the chat is just about, will this video be shared? And they will be uploading the video. So are there any other questions about the member experience that I can answer before I pass it back to the rest of the team?
I guess the silence would suggest you could move onwards.
Lovely. Thank you, Megan. That was really, really good. Oh, there's a question.
Gavin?
Hi, sorry, is my mic on?
Mhm.
It is, yeah, brilliant. I was just typing it out. Would the patient need an exact diagnosis before referred? So if they came in with shoulder pain, how would we work out exactly what that treatment plan should be? Whether it could be general shoulder pain, a torn rotator cuff, or would they need to know that before they were referred?
Okay, great question. So they do not have to have a formal diagnosis. Like, you don't have to decide it's biceps tendonitis versus rotator cuff tendonitis, for example. The shoulder pain category, where if you believe it's an MSK, a musculoskeletal condition causing shoulder pain, is enough information for us to then have the physio look at them and decide a course of action for them. If there's any red flags that we pick up on that weren't picked up on before their referral, we can always send them back to you. So if we, for example, ask them questions and learn, oh, they're actually having cardiac red flags with that shoulder pain that we think maybe weren't expressed to their GP prior to coming to Thrive, we would then send them back to you. But most of the time, if it's musculoskeletal, and that's the only level of diagnosis you need.
Well, thank you.
And we have a question from Alan.
Hi, I put it in the chat, but I'm happy to ask it. I'm just wondering, is the physio able to upload bespoke exercises that they might have designed themselves?
Great question. And no, we do not have the ability to upload that because of the way that the tracking works. So we have a pretty broad exercise library from which we can provide exercises. And then obviously we can provide guidance on things outside of the program as needed as well. So for example, if you have somebody who's having pain at their desk, we might walk through okay, you're doing your exercise sessions, but we're also going to do some chin tucks, and this is how you're going to do that during your day, whatever it might be appropriate for that person.
That's great, thank you.
Okay. I see a question in the chat about the demographics of people that access these programs, where our research comes from. Just wondering how people manage. Are you just wondering about broad participation demographics, or is there something more specific about that you're looking
Yeah,
for?
I'm just thinking about sort of northeast sort of demographics, a lot of people sort of socially deprived, low sort of literacy levels, that side of things. I was just wondering, yeah, how people engage with us, who you predominantly maybe have had engage, and how successful it's been across different demographics.
Perfect. I'll start, and then I'll allow Robbie or Luke to jump in if they want to add any color to what I say. We have worked with people of all ages. So in terms of age, our oldest member is in their late 90s, so kind of any age. And then fairly equal gender split. In terms of areas of social deprivation, we've actually published research on our outcomes looking at social deprivation indexes and seeing that with people who are historically more deprived from resources, their outcomes are typically very similar. And in some cases, depending on the population we're looking at, we actually see better outcomes compared to socially deprived or non-white ethnicity groups. And part of that is because we are able to provide all the technology. So we're sending them the device. We don't have to rely on them having a certain caliber of device. We are able to provide them care that doesn't rely on them having transit, childcare, time off work, and all of those other historical barriers. It's available any time of day. So, if they are working a shift or like on maybe 2 jobs, a non-traditional schedule, they can do it when works best for them. And we have physio hours that are quite broad for those initial calls as well. And it also takes away, this is a bit of a personal bad. I think part of what helps is it takes away some of the ability for us to even have bias towards people. Like in the clinic, when you're face to face with somebody as a provider, while I think all providers would like to not be biased, there is some inherent bias that probably comes into those conversations. By bringing it into a digital space, we can remove some of that bias by providing like really objective support for people as they go through their programs. Robbie or Luke, would you like to add anything else to that?
No, I think you've summed up pretty nicely, Megan. Just to go back to the question originally, who's this population, or what's it based on, the data? The majority of these data have come from the US, because that's where we've been set up for longest. But in the US, we cover all populations, rural, including where you could be hours from the nearest hospital to urban city centres. I just pulled up some of our numbers while Megan was talking. Roughly 2/3 of the population treated have been white. The rest have been from a range of minority ethnic groups. So we do touch all bases. Our mean age is 49 going through the program. We've had people right up to into their 80s, people in their late teens and 20s as well. So I think it is a very accessible program. The last thing I would mention is for the small proportion of people who don't have access to Wi-Fi at home, we'll actually post out a Wi-Fi dongle as well. So that shouldn't be an impediment to someone taking part in the program if they want to.
And just to mention, North Tyneside will also be looking at a deep end practice. So that might be enable us to kind of do a deep dive into the demographics and some of those social deprivation challenges as well. So thank you for that question. We've got a question from Alan.
Yeah, Hal's question kind of prompted another thought from me, which was in North Tees and Hartlepool, we have quite a high diverse population, if you like. So does the program support other languages other than English?
There's kind of 2 parts of the program. So for that video call, we can always have a medical interpreter join, and we also have the ability to use closed captioning to interpretation if people prefer that. So the synchronous calls, we can always use that for whatever language the person may speak. The device itself is available in English, Spanish, French, and Portuguese. And includes, like I mentioned, video, audio, and written guidance. So even if somebody isn't, for example, fluent in English, the visuals are strong enough that they can typically bring people through the exercise program with a supplementation of that synchronous contact with interpreter support.
Well, thank you.
Brilliant.
Any
We've
other
got
questions?
no more. Oh, sorry, yes. No, I don't think we've got any more questions. So we'll move on.
Lovely.
I think we might have one in the Q&A.
Yeah, it's from Katie Davis around many of these patients were on a waiting list for local MSK services. How will information be shared from SWORD to MSK team GPs to support them for the future? So I can cover this at the moment, Katie. There's a challenge around the data sharing agreement. So it is a support with the WorkWell coach, who supports the patient to do that self-referral, and they'll go on a web page in order to do that. And then obviously SWORD have that safety element from a clinical perspective. If something's not right, to send them back to their GP or the MSK team. So there is a loop round. Once we've got data sharing agreements put in place, which we're working on over, well, we'll get past Christmas first. We might then open that up a little bit, but we've certainly put a workaround in place. So just to let you know.
Lovely. Okay, I'm just going to go back to the slide deck. So as we just touched upon the referral process, I'm just going to quickly talk about the referral process. So appropriate individuals will be flagged and the referrals can be submitted directly email to us, ukreferrals@swordhealth.com. It is really basic information: first name, last name, email address, telephone number, and they will then get sent an enrolment form to be able to complete. Now there is obviously discussions about self-referrals as well, but that is the standard process that we will be using. It is really, really simple. And then that starts the process of what Megan spoke about, with having their triage calls with their PTs and then their kit being delivered. At any point, anyone who is referring can contact ourselves if there's any questions or any concerns with regards to referral process. But it is a really simple process, and hopefully being able to see Thrive in action, how it works with Megan's demo, you will be able to talk about it as well to those patients. And that is the end of our deck. Thank you very much.
That was great. Thank you very much. It's given us a great insight into what SWORD is all about. And I think that live demo was really beneficial, Megan, because I think unless you see it, it's really challenging, isn't it, to understand what that patient might be under. Obviously we've got WorkWell coaches on, MSK leads. So it's been a really great insight for them to be able to see how that works. And I guess they'll probably want to test it out themselves a little bit as well, of course. So, so we did touch on it's a SIM card enabled. My question would be, how simple is it for a patient to open that box if they're not a digital person, and because it's kind of like, I've got this tablet, what do I do next? Are there written instructions in that box? How does that work?
I can answer that. So it's quite simple. It comes in just like a standard box. And then when you open it up, there are some pieces of information in there. So there is that little booklet that explains how to work. The device itself, like there's an overlay that sits on it where it says press here, to turn on. So it has that peeling sticker. But I think the biggest thing to emphasize is not only is that experience really simple, it's after they have connected with their physio who's going to be supporting them. So there's that human who's already explained the basics of what to expect and is available to them if they need help. I've been at SWORD for like nearly 6 years at this point. I've probably only had to help 2 or 3 people actually set up their device for the first time. And the one person was very obvious to me that I was going to need to, because when I met her on our video call, and I was explaining that it was going to come to her in the mail, they were going to send a tablet. She laughed and just told me good luck, like she was still using a house phone. And so was not really optimistic, but so that's no worries. We'll just do this together for the first time and we'll be able to set it up together and we'll get you going. And she needed a bit of support, but once we did it the first time, she was good. But of the members and patients I've worked with for the last several years, it's really quite simple. And so they have that human there to support them if they need to, but we make it as easy as possible for them to be successful.
We've got a follow-up question from Hal around inclusion criteria. So I know we've looked at eligibility already, and Charlie and I have been having some offline conversations. But Megan, have you got any advice and guidance for the people on the call around that?
Yeah, so high-level inclusion, the program is appropriate for people who have musculoskeletal concerns without red flags that warrant in-person supervision. So for example, somebody who just has low back pain, maybe they have some pain down their leg, but they're not experiencing any problems like their foot's flopping around or they're having a loss of sensation in their leg. That type of person would be appropriate for us. If you meet somebody and they have a musculoskeletal condition and you think there might be a fracture, for example, you should have them do that imaging to rule out fracture prior to come to SWORD. But the majority of people who have a musculoskeletal condition without any red flags would be appropriate. But the big exclusions are inability to perform active motion through that body area. So if somebody had a surgery and they're not allowed to move their arm, we probably can't work on their arm for that initial phase. They need to go to in-person physio. Somebody who has pain, but it's not from a musculoskeletal cause, so something like gout or lupus or a burn is probably not appropriate. Somebody who has like a fever, chills, severe swelling, where you're suspicious of an infection isn't appropriate. And anything that's like a progressive neurological condition, like they're experiencing strong loss of strength and mobility due to something like multiple sclerosis, not appropriate. And the last thing I'll just highlight is like a very high fall risk. So if you wouldn't feel safe with them doing exercise or movement without somebody next to them, they wouldn't be appropriate. The good thing though is that we will do a second level of screening when we meet that patient to make sure that they are appropriate. So you think they're healthy enough, you think that they are a person who could benefit from physio, there's nothing really worrisome that needs further investigation before you would send them to in-person physio, for example. You can send them to us and then we can make sure that we agree with that and we will send them back if they're inappropriate. And generally we are able to work with something like 98% of people who enroll. It's rare that we exclude people, but we will if it's unsafe.
And I think that our audience will probably find that useful. Charlie and I have been talking about just pulling together a little hint list of things. So covering off some of those eligibilities to make sure that we're not getting the wrong patients kind of sent through. So that will come out very shortly. So we've got a question from Katie Davis. So if a patient has a 12-week programme, although yes, they can keep the tablet for a 12-month period, will the patient still receive physio input during the time that they have the tablet, even after they've completed the first 12 weeks?
So 12 weeks is typical program length, but the person might need a little bit longer, a little bit shorter. And as you mentioned, they are able to continue with the device for a longer period if they're using it to do what we call maintenance. So their pain's under control, they're doing great, they're going to continue doing their exercises for a bit, and they would like the support of the device to give them that feedback. Once we have completed the program with the main crux of the program, we've reached their goals, we've essentially discharged them, that's the place where the physio will stop providing support and we will educate the person that if they're doing exercises, it's almost like doing that piece of paper your physio has given you at the end of your in-person journey, where if you have a problem, you need to proactively come back to the physio. So we won't be looking for that person to engage at a certain frequency. We will not be reaching out to them on a regular basis or looking at their results to change their program. At that point, we are saying like, you are independent and we are here. If you need us, come back to us if you need us. And so it's putting the ball in the patient's court at that point. But we will educate the person very clearly that that's the change in expectation from more of us being proactive to us being reactive to them at that point in their journey.
So just to clarify on Megan's point as well, that wouldn't mean another referral coming from the WorkWell coaches back to Sword. That would just be the member reaching out and saying, I've had a flare by a shoe, can you help?
Oh, thanks for clarifying that. Yeah, so they're just saying, I need a bit of support right now. Perhaps this exercise is, or maybe it's just something as simple as like, I hurt my wrist and I can't do this one version of this exercise that's in my maintenance program. Could you switch it to a different one? Because I'm working on my exercises for my back, but I just can't put weight on my wrist anymore. Perfect. I see a question from Hal around non-adherence to the program or not attending. What levels of dropouts do you see? So we see something like an 83% completion rate. So some people do drop out of the program. The way that we support people is based on the goals we've set for their adherence at the beginning. So perhaps we've said you're going to do 3 or 4 sessions a week. If you do those sessions, I will see them come into my portal and we'll follow up on you based on those sessions. If we don't, we will also see that you are not performing the sessions as we expected to and reach out to you via chat messaging, calls, emails, whatever we need to get your attention. The goal is to try to engage you, and we'll really work to do that over about a month-long period before we then say like, okay, this person is just ghosting us. We're hearing nothing for the last month and we're not getting them to adhere. The goal with adherence is to really figure out what the problem is that's stopping the person from adhering. Sometimes it's that they don't understand how to fit this into their life. Sometimes that they don't think you're going to help them and they think it's a waste of time. Other times they are worried about pain or something else, and we can actually kind of uncover those barriers and work through them together. One of the nice things about Thrive versus more traditional physio is that we have really quick information about people who aren't adhering, because if I'm expecting you to do a session today, you don't do one today, you don't do one tomorrow, I know that and I can jump on it, versus having you come back to check in a month from now in the clinic and you just haven't done anything in the last month. Or we say, you know, call us if you need us, and you never call us, but you also still need us. So we will work together to get them to stick. And then if the person has completely stopped engaging, we're not getting anything from them, after about a month, we will wrap up the program.
We pull Gavin in.
Hi, it's just a quick question. if throughout the program you spot something that is maybe an underlying condition with one of your service users or patients, are you able to generate any kind of referral to a local service if you feel the need that?
So we're excuse me, we're not set up with direct referrals to secondary care from SWORD. So for example, if Megan detected a rheumatological issue, we can't refer directly to rheumatology from SWORD. What we do is signpost back to primary care, or potentially in this circumstance back to the WorkWell coaches. I guess the exceptions are around emergencies. If we detect an emergency, then we're referring them to emergency services. If needs be, we need to call 999 on during a call. We'll do that. But usually we'll be saying to the patient, you need to go to your GP, or you need to attend A&E today when you can.
Thank you. Alan.
Yeah, I'm just wondering. So I'm thinking of scenarios in my head. So someone's attended SWORD, they've gone through a bit of a program. Maybe it's helping, it's not helping. You guys keep, I would imagine, electronic patient records and stuff like that about what maybe a working diagnosis is and what's going on. Are you then able to share that with primary care or secondary care services should a patient need an onward referral? I'm thinking, a patient then goes back to the GP and they get referred into intermediate services, and maybe that things begin to be replicated, or there's a bit of repetition. Is that a thing? Am I making sense? I hope I am.
You are.
Yeah. So yeah, absolutely. We can download patient-specific reports, which the physio can share directly with the patient, and they can take that to wherever they're going.
Well.
Brilliant. So last opportunity, guys. Anybody got any questions? Anybody? Oh, do we have promotion to share with GPs? It's just gone live today, Nicola. So yes, we have officially launched. So there's a very short video which will enable you to be able to share with that GPs. It's got Robbie on there, so that's really good. And you'll also get a link to the SWORD Thrive website for general promotion materials as well.
We can also make available promotion materials that we use typically, so flyers, leaflets, that kind of thing. Maybe if it's helpful, we can take the email list today and share something after the call.
Yeah, that would be brilliant. Thank you, Robbie. So we'll follow up, and everybody on the call will get access to those. And we've got another question from Hal.
Sorry, I'm probably similar to Alan, which is active mind. So back to Robbie, really, just to follow up. Patients in primary care now have access quite readily to notes via NHS app and things like that. Do they have access to their records via SWORD as well, where they can download and have a copy themselves if they're that side of things?
Yes, so that they can download via the SWORD app. We're not yet integrated with the NHS app. That's very much on the roadmap, but patients still have full control over their own data.
Yeah, so if there was someone was coming into an MSK service and you wanted to review what they've been up to, that side of things, they would be able to, they could do that themselves, but they could also get it via via you guys. Yeah.
Yeah, exactly. They can just show up with the SWORD app in their hand and walk their orthopedic surgeon or whoever through it.
Okay, thanks very much.
And any final questions? I think we've thanks, guys. Questions are always really useful. And I know Hal's going, oh, I've got another one. But that's great, because there are some people who are not as confident asking questions. It was probably on their own minds as well. So I think that's been a really great discussion. What it has certainly done is all the questions that I've been talking to the LDT teams, it's answered a lot of those questions that they had personally. And we've been able to cover that within this session. As I said, it's recorded and we're going to share that online so people can rewatch or certainly share with their other colleagues as well, which is really useful. So if we've got no more questions, I'd just like to thank not just the attendees today. Thank you for coming along. This is kickstarts this programme, and SWORD will be delighted to start getting referrals through very shortly. We will be following it up with some additional support and training. We're just working with the ICB on that as well, and we're contactable should you need to reach out to us at all. But I'd like to thank personally Megan, Robbie, Charlie and Luke, who's hidden in the background somewhere, for their time today and given such a great coverage of what SWORD Thrive's all about. And I'm sure everybody would join me in thinking it's going to be a great product to be able to support what we are trying to achieve, and certainly complement the MSK services as well. So I'm absolutely delighted that we've been able to hold this session today. So we're going to let you drop off. If anybody has any questions after the session, then please do drop me an email. I will make sure my email address is popped into the chat here for easy access. So please do reach out. Although I am on leave this week, so please be kind. It'll be next week before I respond.
Thanks, Richard. Thanks, everyone.